Have you ever walked out of a doctor's clinic, feeling like your concerns were not taken seriously? Maybe you felt rushed, ignored, or quietly judged because of your age. If yes, you're not alone. Today, we are opening a door that many seniors want to look through, but very few actually do. A door that reveals something sensitive, something important. What do doctors really think of older people? And what are the truths every senior must know so you can protect your health and your dignity? Stay with me. This video may change the way you look at doctor visits forever. As we grow older, our relationship with doctors becomes more frequent and more important. But often, seniors feel unheard, like their age becomes the reason for every complaint. This video is not against doctors. Not at all. Doctors are hardworking people with good intentions. But the system they work in is rushed, overloaded, and sometimes insensitive. Understanding these hidden truths will help you speak up confidently, take control of your care, and stay informed. So let's gently begin. Truth 1: Many doctors assume your problems are just because of age. You've experienced this, haven't you? You say, "Doctor, I feel tired." And the reply is, "It happens at this age." You say, "My knee hurts." Age factor, they say with a smile. But here's the part most seniors don't know. Aging is not a diagnosis. Not every pain, not every symptom, and not every change is simply because you're old. Imagine this. A 70-year-old reports severe back pain. Doctor calls it age. But later, the real cause turns out to be vitamin deficiency, something easily fixable. Or a senior says their memory feels weak. Doctor says, "It's age." But the real issue was a medication side effect. Doctors meet so many seniors with similar problems that they start assuming the cause without checking deeply. This truth is harsh, but knowing it protects you. Next time a doctor says, "It's because of age," you can gently ask, "Is there another possible reason? Can we explore this a little more?" You deserve a proper answer, not a shortcut. Truth 2: Doctors often think older adults may not understand instructions clearly. This one is sensitive. Many doctors quietly believe that older people may forget instructions, get confused with complex medicines, misunderstand timing or doses. Now, is this true for some people? Yes, but it is not true for everyone. The real problem isn't age, it's communication. Doctors talk fast. They use complicated medical terms. They explain too much in too little time. Imagine. A doctor says, "Take this twice daily after meals." But does "after meals" mean immediately? 30 minutes later? After breakfast and dinner? Or lunch and dinner? When instructions are unclear, mistakes happen, not because seniors can't understand, but because doctors fail to explain properly. So here's something gentle you can say. "Doctor, could you please write this down clearly?" Or, "Can you repeat this in simpler words?" This helps you, and it helps them too. Before we move forward, let me gently ask you something. Have you ever left a doctor's office feeling unsure about the instructions, or feeling like things were explained too quickly? If yes, I would truly love to hear your experience. Please share your answer in the comments. Your story might comfort another senior who feels the same. And if this video is helping you so far, please give it a like. Subscribe to the Wisdom Vault. And share it with someone who might find it useful. Also, don't forget to watch this video till the end, because the next truths are even more eye-opening and can genuinely improve your health journey. Truth 3: Doctors are afraid of missing something serious, but still rush through appointments. This is where things get complicated. Doctors know that older adults have higher risks. Heart disease, infections, medication reactions, sudden blood pressure changes. So inside, they're often nervous that a serious issue might be hiding behind a small symptom. But because clinics are overcrowded, they still rush. Imagine this situation. You walk in and say, "I've been having slight chest pressure." Deep inside, the doctor knows this could be serious. But with only 8 to 10 minutes per patient, they may ask quick questions, check blood pressure, and send you for tests later. Appointments feel rushed. But your condition feels important. This mismatch creates fear and frustration for seniors. That's why preparing before your visit helps. Write down what you're feeling, when it started, what makes it better or worse. This way, even in a short visit, you won't forget important details. Do you sometimes feel the doctor wants to finish the appointment quickly? If yes, it's not in your imagination. The system is rushed, but you can still advocate for yourself. Truth 4. Doctors often overlook seniors' emotional pain. Doctors focus on physical checkups. Blood pressure, sugar, joints, heart, lungs. But what about loneliness? What about grief? What about the stress of losing loved ones, becoming empty nesters, feeling isolated? These emotional pains are often invisible, yet very real. And many doctors don't ask about them. A senior walks in and says, "I feel tired all the time." Doctor checks the BP, the sugar, and says, "You're fine." But that tiredness may come from sadness, anxiety, loss of routine, lack of companionship, poor sleep, emotional fatigue. Doctors don't always dig deeper. And seniors don't always share how they feel emotionally. So here's something you can say. "I've been feeling low lately. It's been hard emotionally. My sleep has been disturbed." Sharing even one sentence opens the door for real support. Let me ask you. If you feel lonely, sad, stressed, or mentally tired, do you talk about it with your doctor? If not, please remember, emotional health is real health. Truth 5. Doctors focus more on treating diseases than improving your daily life. This truth hurts. But it's important. Doctors are trained to fix diseases, read reports, prescribe medicines, follow guidelines. But seniors want something different. You want comfort. You want independence. You want to walk without fear. Sleep peacefully. Remember important things. Enjoy your tea time. Live with dignity. Imagine. A doctor prescribes multiple medicines to control numbers on a report. But those medicines make you weak, dizzy, or tired. Your report looks better. But your life feels worse. That's because doctors often treat diseases, not people. But here's the good news. You can gently guide them. Ask, what treatment will improve my daily life? Is there a simpler option? Can we reduce unnecessary medicines? These small questions can transform your care. Truth 6. Doctors sometimes forget older people still want respect, choice, and independence. This is perhaps the most painful truth. Some doctors, not all, unconsciously treat seniors like they are fragile, incapable, dependent, unable to make decisions. But older adults have lived full lives. You have raised families, worked hard, built homes, faced challenges, survived losses, gained wisdom. You deserve respect. Yet sometimes, the doctor talks to your son or daughter instead of talking directly to you. Or they make decisions without asking your preference. Or they speak in a tone that feels condescending. You have every right to say, "Please speak to me directly. I want to understand everything. I want to decide for myself." One small sentence changes the entire tone. Why these truths matter. Understanding these truths does not mean doctors are bad people. Most doctors are caring and hardworking. But the system, the workload, and the stereotypes make things difficult. When you understand these patterns, you become stronger. You learn how to speak up, you learn how to ask the right questions. You learn how to receive the care you truly deserve. This knowledge gives you independence. Even inside a medical system that often overlooks seniors. Before we end, please remember this. You are not just an old person. You are a complete human being. With memories, wisdom, love, and value. You deserve to be heard. You deserve to be understood. You deserve to be respected. Never shrink your voice in a doctor's office. Never think your pain is small. Never assume your concerns don't matter. Because they do. You matter. If this video helped you understand your health better, please give it a like to support this channel. And tell me in the comments. Have you ever felt misunderstood by a doctor? Your experience can help others feel less alone. Also, don't forget to subscribe to the Wisdom Vault. For more calm, supportive videos made especially for seniors. Take care of yourself. Stay strong. Stay hopeful. And remember, your voice is powerful.